Hello, everyone. I'm Leonel August Rodriguez, the VP of Business Development for Access Medical Labs. I'd like to thank everyone for joining us on another Access Live, where we bring you insight from leading medical experts. We do ask that all questions are submitted via the Q&A, as they will be answered at the end of the presentation. If you do miss asking any questions, you can always email them to learnmore@accessmedlab.com. So today we have a very special guest who will be speaking on hormone optimization. He is experienced in the field of obstetrics and gynecology and has been in practice for over 15 years. Ladies and gentlemen, from Legends OBGYN in Kansas, Dr. Donald Peghee.
All right, thank you, Lionel. I appreciate that. I'm gonna go ahead and move to my slide presentation to go ahead and share my screen if everybody can see that. And as he said, I'm from Kansas City, Kansas, and actually born and raised in Kansas City, Kansas. Went away for school and came back to my hometown and practiced OBGYN, both obstetrics and gynecology. And what I did is sort of make it a change here within the last year to where I was doing more office-based type of procedures and office-based medicine. I was solo practice all that time and still solo practice. And as everybody knows, at OBGYN, getting up 2, 3 in the morning is very stressful. And after a while, it gets wearing on you. And so besides the life-work balance, there was one other thing that sort of happened to me. I'll just sort of tell you in the form of story that it was one morning, 2 in the morning, sort of my typical morning, getting called, hey, she's almost complete. We need you here at the hospital. So I'm jumping up, getting out to my car, driving. As if there's other OBs on here, you know, we're probably speeding majority of the time. So rightfully so, we're trying to get there on time to catch the baby. And I'm going down a particular street that's close by the hospital and get pulled over by the police there. Like, man, all right, I know the routine. Let me get my license. I got my car insurance right in my hand. Hands are on the steering wheel, because in today's time, how police officers are. And so he came up to the window, wrote it down, and during the time, the hospital's calling me, hey, Dr. Peghee, are you on your way? Where you at? I say, hey, I got pulled over by the police. Hopefully I won't be delayed too long, sir. This is the hospital on the phone here. You think I know I was speeding, probably. Do you think we could hurry this up so I can try to get to the hospital? Oh, yeah, we'll try to be fast. And so they hung up. And so I gave him my license and car insurance, and then he asked for the registration. I was like, it's in the glove compartment. Can I get it out of the glove compartment? He says, yes. So I go to reach in the glove compartment, and boom, that's when things switched. I did a total 180. He pulls his gun out on me and said, hey, where are your hands? What are you doing? What are you doing? And I'm raising my hands like, look, I'm just doing what you asked me to do. Okay. And before that, my life is just flashing before my eyes. Okay. What's going to happen in these next 30 seconds? Am I going to live or am I going to be dead? There might be a statistic that everybody reads about. Okay. That flashed before my eyes. The officer, finally let me get into the glove compartment, gave him the registration. He looked things over. After some time of being held up, finally got to the hospital. Of course, I missed the delivery. But during that time, only thing I could think about is my life over. I mean, this is my family here. Is this the last time I'm going to see my family all over a delivery? And so from that time going forward, my mind was set. I need to do something that's more office-based medicine, to where I don't have the opportunity to get pulled over. I have the opportunity where my life is going to be taken by an officer who doesn't respect anyone. Now, as far as the hormone optimization, we're going to talk about and highlight that today. We're going to recognize the importance of the hormones, how to evaluate the different hormones in our bodies, and then the options of treatment. And at the end, I'll also share some other things that I do in the office that may be of interest to individuals who are wanting to do more office-based type procedures and alternative stream of revenue as well. The hormone havoc. So what are hormones and why are they so important? And what is hormone imbalance? As we all know, chemical messengers that made by the endocrine glands that act to control certain actions of cells and organs. They work in a lock and key fashion. So do we age because we lose our hormones, or do we lose our hormones because we age? That's a little bit of both. Now, things that affect our hormones are definitely our eating patterns. Here we have two different food pyramids. The one on the left is sort of the more antiquated FDA food pyramid that you would always see, where the breads and the grains are at the base, and then you have your fruits, then you have some of your meats and dairy, okay? To the right is a more revised version of the food pyramid. Now, as far as the counseling that I do in the office, with weight loss as well, and just overall healthy living and a whole health emphasis, in which I really push for a 70% fruits and vegetables type of diet, in which you see on the pyramid on the right, the base is going to be your fruits and vegetables, okay? Then you can get into your breads and carbohydrates, and then some of the dairy products, and the meats are more toward the top, okay? So we're not heavy on the meats, because as we know, eating meat, that's sort of a secondary process of getting our nutritious nutrients. And our vegetables and fruits are going to be the primary source that our body can readily use for energy. Here, this is from the Harvard School of Public Health, in which it shows sort of a healthy eating plate, in which you have your fruits and vegetables making up at least half, and I, like I said, recommend more 70% even of that plate. And the more vegetables, the more fruits, the better, okay? The healthy oils, okay? Again, avoid the trans fats though. You want to eat plenty of fruits of multiple colors. And this is also good for children as well, in order to see how their plate should be filled with healthy variety of foods. You also want to eat a good variety of whole grains, whole wheat bread, whole grain pastas, okay? And limit the refined grains like the white rice and the white bread. And always drink plenty of water, plenty of water. If you go to the CDC website, you can choose myplate.gov. And again, sort of how a healthy plate is made up in terms of the portion sizes, okay, of your fruits, vegetables, your grains, your protein, and small amount of dairy. So ultimately, other than the diet, we want you to move, okay? I push movement, exercise. Doesn't matter if it's large amount. I mean, I'm not looking for them to be a gym rat, 1 or 2 hours in the gym, but 20 to 30 minutes a day, 4 to 5 days out of the week is very good. Anywhere from like a mild, moderate type of exercise routine, just to get moving. It helps with your metabolism, it helps with your digestion, it helps for your foods, it helps with your hormones overall, okay? You can see the guy in the office suit, just doing toe raises, okay? Sometimes we can do that in our chair in the office there, okay? Some of the other people doing the squats, okay? The sumo squats, okay? But the bottom line is that I try to emphasize to my patients just getting out and moving and exercising, because ultimately we don't want them to feel like this, okay? Because when your hormones are out of whack, imbalance, this is how people feel. And we want them to feel like this, happy, okay? Enjoy life, have a quality life. There may be some people like this even on the call right now, okay? Sort of almost falling asleep, can't make it through the day, okay? We want you to be energetic and focused. Get rid of that brain fog, okay? And that's what we want to do in terms of hormonal therapy. We try to get you back to optimal hormones. Again, people who are imbalanced on hormones have a lot of mood swings, anxiety, okay? The women, hot flashes, night sweats, weight gain, memory loss. That's a big thing. Memory loss and brain fog, okay? Just that lack of focus that people don't have anymore. Lack of sleep, waking up multiple times throughout the night, whether it's to get up to use the restroom, or they have so much going on in their mind in terms of stress, in which we really can't quantify stress as the waking them up and keeping them from having a good night's sleep. We definitely, as we all know, that getting at least the REM sleep, the rapid eye movement sleep, okay, about 3 to 4 hours of rapid eye movement sleep is going to be very beneficial to your overall health. Individuals have seen studies dealing with sleep apnea. And in those individuals with sleep apnea, they have a lot higher risk of heart disease, heart attacks, high blood pressure, okay, and death overall. And of course, a decreased sex drive and performance. Now with the BioT company I go through with the bioidentical hormones, there's other companies out there, but BioT is the one that I chose, okay? And what they really focus on, which is really good, is the testosterone, the estrogen, and the thyroid hormones. And there's other hormones such as cortisol, leptin, and so forth, but these are the main three that are focused upon that help tune in and actually modulate your metabolism to where it's more optimal. Okay. There are also nutraceuticals that are more of supplements, natural supplements that help with the hormones to function better. And with the thyroid hormone, when it's suppressed, again, this is just an illustration from BioT of when it's suppressed by stress, depression, weight gain, insulin resistance, low testosterone, okay? And one other thing too, at the very bottom, is low as far as iron deficiency anemia can also have an impact on the thyroid gland. Again, this is just another screen here as far as showing the role of the thyroid and some of the things that are affected in terms of the leptin resistance, again, low testosterone, diabetes, that can affect that person's metabolism. So approaching somebody's whole health is a lot of times a multifactorial type of approach, in which it's not just one single thing, okay? There's no magic bullet or just a magic pill or one pill that you can take to just reverse everything. So it's a process, and it's something that happens over time where we develop good eating habits, good exercise habits, and also as far as the hormone optimization. This is just another slide showing about the hypothalamus and the thyroid and pituitary gland as far as that axis and how they're all involved with feedback mechanisms involving the thyroid gland with the TSH and free T4, okay? Now, what are some myths about the thyroid gland? T4 is good, T3 is bad. No, not really. So T3 is a molecule that's present from birth and is very essential to life. There are no studies that have shown T3 damages the heart, brain, or any other tissues. And actually the opposite is actually quite true, as we'll see later on. T3 will cause atrophy to the gland, causing permanent dependence on thyroid hormone replacement. No. So there's no evidence that has ever been shown that it damages a previously healthy gland to prevent normal function, okay, when the medicine is discontinued. Suppressing TSH will cause osteoporosis. Oh, no, not with that one either. So with the hyperthyroid disease from Graves' disease, where you have endogenous production of the thyroid hormone, that can be linked to bone loss, okay? However, there's no study that has shown any adequate or upper limit of T3 levels that are linked to bone loss themselves. Once you start thyroid, you will need it the rest of your life. Only if a portion or a full removal of the thyroid gland has taken place. Now, what does the thyroid function to do? Well, it regulates the temperature, our metabolism, our cerebral function, energy. It helps fix leptin resistance, increase the fat breakdown, okay? And what does it protect against? Cardiovascular disease. That's a big one. Number one cause of death in the country is heart disease. Cognitive impairment, fatigue and weight gain, memory loss. So when we have a deficiency of our thyroid, these are some of the symptoms that our patients are going to come to us asking. Sometimes they don't, and we have to ask and inquire of them, okay? As far as the cold intolerance, fatigue, the thinning hair and nails and skin, the weight gain, loss of energy and motivation, loss of memory, depressed mood. Sometimes it can cause infertility, definitely menstrual irregularities, which I see as a gynecologist. The constipation and gut motility is affected by a deficient thyroid as well. And some of the causes of the decreased production, well, definitely autoimmune thyroiditis, okay, with the Graves' disease. Surgical removal of the thyroid. One that we don't see in this country often is the iodine deficiency. And generally that's in other countries, but however, in rare instances, you can still find that here in this country. A failure of the hypothalamus or pituitary gland, inflammatory cytokines involved in the stress response. In the era of COVID, with the pandemic of COVID, we have seen this more and more in terms of these inflammatory cytokines. Individuals with COVID have a higher risk of cardiovascular disease, hypertension, okay, obtaining diabetes. About 1/3 of the people who had COVID were obese, okay, had a BMI greater than 30. So very important in terms of the effect of COVID on the thyroid gland and overall metabolism as well. And again, and the leaky gut could cause thyroid deficiency. So it is the low T3 at the cell level that is responsible, okay, for the lab ranges that we look at. Optimal for T3 is about 4.0 to 4.3. Of course, there's a lab range where it starts at 2.3, but who wants to be just barely normal? We want you to be optimal, where you're feeling your best, your body's functioning at its best. The TSH, we're looking at for a range of 0.3 to 5. Well, the optimal is going, you want the TSH sort of down low to where it's at 0.3, okay? Again, we want optimal levels where individuals have a highest quality of life and that they're functioning at the best. The different treatment options for low thyroid involve the medications you see here, the traditional Synthroid, levothyroxine, the T4, Cytomel. The desiccated thyroid actually has all three, T4, T3, T1, and T2. Has a larger portion of T3, just a smaller portion of T4, maybe about 20%. Then you have the non-desiccated thyroid. The medication that we really push that's going to be most bioidentical to the human body is the desiccated thyroid. Okay, it's created from the pig's thyroid. With that, we know that as we age, the T4 is harder to break down into the free T3. And so that's one of the reasons why we have to always increase the T4 when people are on Synthroid or levothyroxine. So with the desiccated thyroid, we can sort of be a little bit more specific and really give the body the T3, which it really needs to function at its optimal level. So is there really a menopause out there? Yes, there is sort of a menopause. There's some facts here about andropause, okay? About 38% of males over 45 years of age have low testosterone. It's very common in men who have diabetes, high blood pressure, again, sleep apnea, and other chronic diseases. And it's linked to early heart disease. Testosterone itself is present in both men and women, definitely larger amounts of men and small amounts of women. And men aged 30 to 70 will lose about 1 to 3% production each year. Women between 20 and 40 lose up to 50% per year. And that's huge, especially in my field when average age of menopause is 51, okay? But as far as them losing that amount of testosterone, it's really big. Now, as far as testosterone, low testosterone, what else happens? You have dyslipidemia, atherosclerosis. You tend to get arterial hypertension, abdominal obesity, sarcopenia. And as you can see here, as the levels decrease, especially around the 600, 450, as far as the different chronic illnesses that start to arise. And when it's less than about 290, that's when things don't work down below, okay, where erectile dysfunction. Then it becomes a real major problem. So by then, yeah, most of the men are really running to the doctor then. But let's not wait till it gets to that level. Now, some of the positive effects of testosterone for men and women, you have increased energy, vitality, a zest for life, okay, improved feeling for overall well-being. As far as individuals with depression, I've seen it in my office where individuals who were on the different antidepressants were coming off of them, okay, after about maybe just 1 month being on the pellet therapy. Improved focus, enhanced libido, of course. It actually is protective against breast cancer and prostate cancer. It helps with the heart, the brain, the bone, okay, increases the bone density. So as individuals, if they were to fall, they're less likely to have a fracture. It helps lower cholesterol and reduce the body fat. So you'll get more lean muscle. And some things about menopause. About 1.3 million women enter menopause yearly. The symptoms may begin about 15 years earlier, where you have a perimenopausal period. And most women are definitely affected in more ways than one. And they never really get over it or get through it completely, all asymptomatic. For premenopausal women, about 1 in 7 die from heart disease. For postmenopausal women, that number increases to 1 in 3. For those who are not on any type of hormone therapy, 1 in 3. Estrogen is definitely present in both men and women, larger amount in women and very small in men. It has over 400 functions in the body. Controls the hot flashes, helps maintain bone density as well, helps maintain memory. So you're less likely to have dementia or Alzheimer's disease when you're optimal with your estradiol level. Helps maintain collagen in your skin, so you have less wrinkles, okay? Less dry skin. And it also increases the serotonin and dopamine, your happy hormones in the brain that make you feel better. So, you know, I know we give the antidepressant and things, but people don't really have a deficiency of just, you know, Xanax, you know, or you don't have a deficiency of Zoloft. A lot of times it's just hormonal balance that they need to actually get the feeling a lot better. Now, some other positive effects. It helps with the hot flashes again, maintains the bone density, helps with memory, helps prevent neurodegenerative conditions. It does lower cholesterol and increase the HDL cholesterol. Now, in terms of replacement, there is a difference between synthetic as well as the bioidentical. With the synthetic, you have pills, you have patches, you have shots, okay? With the bioidentical, you also have pills, patches, but in addition to that, you have creams and then the pellets. And the pellets is what we'll concentrate on mostly, but we'll sort of go through each of these and give some of the positives and negatives, the pros and cons. We can't leave without mentioning the Women's Health Initiative, okay? I'm not going to stake a lot of time on here, just a couple little comments that they found, you know, 29% increase in heart attacks, 26% increase in breast cancer, twice the rate of blood clots, okay? So what was the main flaw? I mean, most of us know by now. Well, they started these hormones on women that we wouldn't typically start hormones on. And it wasn't just estrogen, but they were given estrogen and a progestin as well. And within that study, it was the estrogen plus the progestin that were actually the culprit in terms of the blood clots and increased risk for breast cancer as well, okay? Most women that we start on hormone replacement, maybe even as early as 35. But on average, they're between 45 and 48 years of age. Now, for us patches, the pros, the estradiol levels can be more consistent than the pills. You don't have that first pass effect in taking a pill. They need to be changed throughout the week, sometimes 2 or 3 times a week. Now, there may be some weight gain associated with it. And the cons to this, or if they have allergy to an adhesive, then they could leave a big rash and a mark on their skin and doesn't absorb as well in some individuals. So what about the creams or the gels? What about rubbing those in? Well, you know, you got to rub it in 2 or 3 times a day, almost like a lotion. You got to put it on certain areas of the body. Well, it's been a few little studies that it could be transferred to sometimes your pets or young babies there. If you're putting it on your wrist and you're holding your baby for a while, it could be absorbed through their skin, okay? The other thing is that the estriol that's in there, it actually doesn't protect against the bones or the heart of the brain. It's the estradiol that does that. And what about the injectable testosterone? Well, it's not so much an even absorption, and you get a roller coaster effect. So you'll get a big surge of testosterone, then it comes down. And when it comes down, the men will let you know, okay? They get very cranky. With that, the adverse effect with the 99% synthetic hormonal testosterone being injected, you could potentially get liver toxicity, heart disease. It does elevate the LDL and VLDL cholesterol, unfortunately. So what about the bioidentical hormone of the pellets? So those, as you can see there, that's the literal size of the pellets that are placed inside the individual. Very small pellets. But they're plant derived from like soy-based plants, and they have a very similar molecular structure as our human hormones. Most biology practitioners, such as myself, find that the pellets do last anywhere from 4 to 6 months. And women, it's closer to a 4-month period, and men closer to the 6-month period. It's been widely studied for many years now, and it gives you a steady stream of hormone in the bloodstream. We have individualized dosing, so it's not one size fits all, based upon their body composition, the BMI, as far as their current hormone levels, okay? It's implanted under the skin, and it's really hassle-free. Once it's there, it's there. You don't have to worry about taking a pill, any type of absorption, and you pretty much get maximum, almost 99, really 100% absorption, and it's based upon your cardiac output. As far as the history of the pellets, it developed back in 1939 in a study where women had a radical hysterectomy, and they started using estradiol subcutaneously, okay, and found that it worked, that these women were not having the hot flashes, okay? They were getting some relief. As far as the estradiol testosterone pellets started coming around more so 1949, where they used both. Okay. Again, it's been 80 plus years as far as the use of pellets and the studies in the US as well as other countries around the world. And this is a schematic diagram that shows as far as the levels of estradiol levels that you would get orally from a pill versus a patch versus an implant. As you can see, the implant, you'll get more of a steady state that stays consistent. So these help the body to return to a normal hormone balance and physiological state. And we want you at your optimal range, okay? I tell people we want you hot, a hormone optimization treatment, keeping you hot, okay? So you're gonna feel your best and do your best. As far as with the pellets, again, 75, 85 years of experience used in multiple countries, no roller coaster effect, implanted just a few times a year, very minimal side effects, if any at all, okay? As far as the practitioners have not found an increased risk of breast cancer in using the pellets, okay? Have not seen an increased risk in terms of blood clots, heart attack, or stroke. So for individuals who have had breast cancer in the past, what are their options? Well, they still have some options if you're going to use bioidenticals and if you're going to use pellets, especially when it comes to testosterone, because again, one of the beneficial effects of testosterone is that it helps against hot flashes and night sweats. And it's actually decreases the risk of breast cancer as far as bioidentical testosterone, okay? Here they've shown less stimulation of any type of breast tissue, right? And treatment with testosterone and estradiol implants does not increase the risk of breast cancer, even in breast cancer survivors. And there's been a study of over 2,000 or 2,700 women aged 35 to 74 who had been diagnosed with breast cancer and had received hormone therapy in terms of bioidentical hormones. And as you can see, the breast cancer recurrence was only 17 per 1,000 person years in women who used hormone therapy versus 30 per 1,000 years in non-users. So it's really beneficial to actually use a form of hormone therapy that's going to be beneficial to the patient to decrease the risk for reoccurrence or even breast cancer. Total mortality rate, 16 per 1,000 person years in hormone replacement therapy, and 30, twice as many, 30 per 1,000 person years in non-users of hormone therapy. Osteoporosis. The testosterone has shown to help build the bone. Okay, estrogen definitely and testosterone helps fortify that bone. So individuals who are on some type of hormone therapy, as you can see here, with the implants, you get the highest amount of bone fortification, about 8.3% per year. For the patches, 3.5%, and for oral testosterone, just 1 to 2%. So again, just showing the dominance and superiority of the pellets over just a routine oral pill. Also helps decrease arthritis, okay? About 10% of men and 18% of women over 60 have osteoarthritis. So both estrogen and testosterone can help precardiac cells possibly reversing the development of arthritic tissue. So this is really big. Alzheimer's disease, again, about women 8 to 1 over men get Alzheimer's disease. So those who are on estrogen are 50% less likely to develop Alzheimer's disease. Men with low testosterone, on the other hand, are 3 times more likely to develop Alzheimer's disease. So as far as estrogen replacement and its effect, it does have a positive effect on the body fat in postmenopausal women to help improve the lipid parameters. It'll help increase the HDL cholesterol, which is a good cholesterol, decrease the triglycerides, and decrease the total cholesterol and LDL. As far as testosterone, it helps with a marked reduction in fat mass. Okay, again, it helps with lean muscle mass and decrease the fat. Testosterone itself also helps increase the HDL and decrease the triglycerides. And again, lean body mass is improved with testosterone. Now, some of the takeaways with the hormones: that imbalance can occur in men and women at any age. It's not a one-size-fits-all approach. It's very individualized, okay, which is really what I like about it. And the patients love about it as well. that you're taking their health and everything that they do into consideration when you formulate something that's going to help them not only function better, but have a high quality of life as well. And when looking at labs, the low normal labs may not actually be the optimal labs. So it's up to us as practitioners to really interpret those labs for our patients, because our patients, they look at the labs too. They get it into my charts and things, and they, oh man, this is flagged, or this wasn't flagged. I may be normal. Well, you may have to help explain to them and interpret to them, okay, this is a range that the lab uses, but for you to be at your best, you actually need to be at this level. It's looking at it almost like a bell-shaped curve. You want to be at that little part of the curve, you'll be in the majority of part where you're optimized and doing your best. Now, different lab values, we didn't go every single lab value, but things with the thyroid, the TSH, free T4, free T3, TPO antibodies. Okay, we look at vitamin D, B12, your liver enzymes, and total testosterone, a PSA in men. Okay, this is just a chart showing you, as you can see on the far left, looks more like a metabolic syndrome, somebody that's very obese. Okay. And what we're trying to do is get you where not only hormonally balanced, but also with your diet, your exercise, to where you're going to be at your best shape ever. Now, is everybody going to walk away with a six-pack? No. But it's not bad to have that goal. So we're going to get you as close there as possible. Main goal is to get you where you need to be, where you're optimized, feeling your best, highest quality of life. And when you walk to the scale, you're not running away from it. You're celebrating. You're like, hey, I feel good. I look good. I'm going to be active. I'm going to go out. People that feel good and look are less depressed. Now, this time, I'm going to just transition a little bit, and I'm going to give you a little bit more insight to what I do in the office now. And that is with Botox, fillers, facial chemical peels, some of the cosmetic services that you may want to get into as an alternative stream of revenue that will keep you more in the office. Okay, as we know what insurance is, the reimbursement is going down, down, down every year. But it's just another tool, another option to offer to patients, because when you're looking at overall care, this is something that they're looking for too. Everybody wants to look young and feel young. Okay, the Botox that we use in the office called Jeuveau. It's one of the newer Botox products. It's very precise action, and generally takes action within 2 to 5 days after placement. Okay, typical traditional Botox takes about 5 to 10 days. Maximum benefit is 2 weeks out. And I'll show you some examples, okay, of individuals who we had given Botox to here, looking at the frontalis on the left there to see all the wrinkles there. And then on the right, you can see they're very smooth, a lot more youthful looking, okay? So this Botox doesn't give you a stone face to where you can't make an expression. It just helps those wrinkles not to appear. Here's the frown. You can see on the far left, multiple wrinkles there. Then on the right, they're pretty much gone, okay? Another example of the frown around the glabellar area. And on the right, pretty much gone. Those were just those after pictures are taken 2 weeks after. We also do dermal fillers, okay, in terms of with the lip and fine wrinkles, some deep wrinkles as well. And what a dermal filler is an injectable biocompatible gel used to help fill a facial wrinkle, volume loss in the cheeks, okay, or other parts of the face, help augment certain features like nice, smooth, full lips, and give a nice youthful appearance. And it's comprised of hyaluronic acid. Here's an example in which we did the lips, and this individual, and these are pictures taken right after we finish. So this isn't like 1 or 2 weeks after. This is right after we're done, okay, that middle picture. And then the picture to the far right, that's about a week after, probably not even a full week, about 4 days after, okay. You can see a difference. She felt good, boyfriend felt good. And this individual, again, this picture on the left is before the filler, and on the right. So we helped giving her a more natural look. She wanted a more fuller lip. She didn't feel like she had lips. So we sort of helped with the volume and then also of the definition of the lip as well. And this individual, we did fillers on the face. As you can see, the nasolabial folds, and then under the eyes, having some bags in the eyes, and we help pretty much get rid of those, okay? This is immediately after the procedure. The other thing that we do is something called a skin pin. We're microneedling. So individuals that have a lot of acne issues or scarring, even old scars, C-section scars, other scars from other surgeries on the abdomen, sometimes on the hand. We can get improvement with that. And when it's almost like renewing the skin, okay? You get about 3 million microchannels per 30-minute session that go just underneath the dermis there. And what that does is help with the collagen reformation. Beautiful skin is in, and we're definitely help provide that for individuals who are looking to have and beautify their skin, enhance their skin. This individual to the far left, this is before treatment. To the far right is after one treatment cycle, okay? And the treatments are generally 1 month apart for 3 months. And then the picture in the middle is after 2 treatments. And she's due for her 3rd treatment. So by her 3rd treatment, that may almost be totally cleared up. So I just want to end with that and just let everybody know that I appreciate your time and thank you for listening about hormones and about some of the other opportunities you may have in your office and dealing with Botox, fillers, okay, facial peels. And this is my contact information if you need to get in touch with me, website, email. We're on Instagram, LinkedIn. You try to be accessible to all avenues, okay? And I'll turn it back over to Leonel.
Dr. Peghee, amazing presentation, sir. Thank you again. It looks like we currently don't have any questions in the Q&A. However, if anyone does have any questions, you can always email us to learnmore@accessmetlab.com, or you can also capture Dr. Peghee's information, which is on the screen now. Dr. Peghee, thank you again. Everyone enjoy the rest of your day.
All right. Thank you.
Thank you.